I've been asked to talk about the evidence of harm and effectiveness in e-cigarettes. So in mental health settings, there's a real challenge we face with balancing the potential known and unknown risks of vaping with ensuring... Yeah. I think it might be the fan. It might be the fan as well, yeah. Is that any better? Okay. So, challenge with balancing the known and unknown risks of vaping with ensuring people have access to evidence-based cessation aids so that we give people the best chance of quitting. So, how harmful is vaping compared with smoking and compared with not smoking or not vaping? So being part of a team with Anne McNeil and Leonie, who you heard from earlier, that has undertaken evidence reviews annually that's been commissioned by the government. And in our last year's report, we focused specifically on the health risks of vaping. And we searched literature from 2017 until 2021 to look at the effect of vaping on disease risk and disease outcome. And we synthesised the results from around 400 studies, and studies that looked at vaping compared with smoking or non-use amongst people, animals and cells. And we particularly focused on synthesising literature of two types of biomarkers. So biomarkers of exposure, which is a measure of a substance or a toxicant, or its metabolite in the body. So how much of a particular toxicant is in somebody's urine or saliva or blood or hair. And we looked at nicotine levels, and we also looked at cancer-causing toxicants. And then we also looked at another type of biomarker, which is a biomarker of MEBs that is signalling some kind of risk of disease. So that's an objective medical sign where you use to try and pick up either kind of presence or progression of disease. So we looked at studies where they'd measured simple things like changes in blood pressure or white cell count or what happens to your lung function. And we also included studies where there was much more complexity in the measurement, like how does smoking or vaping change your DNA. And we looked at different lengths of exposure to vaping, so very acute studies where there was lots of studies where they evaluated just people puffing on a few, having a few puffs of a cigarette or having a few puffs on a vape, up to much more longer term exposures, so more than 12 months. And we focused on the big killers related to tobacco smoking, cancer, respiratory and cardiovascular diseases, but we also tried to look at evidence where there was any effect on one's mental health when you were exposed to smoking or vaping, although there was only one study included in the review. So when we look at biomarkers of exposure to cancer-causing chemicals or toxicants that are related to respiratory disease or cardiovascular disease, we saw consistently that people who vaped had significantly lower levels of these toxins in their bodies compared to people who smoked. And that was consistent across all studies. When we compared people who vaped to people who didn't vape or didn't smoke, then we saw that these toxicants, or the biomarkers of these toxicants, were either the same or they were higher in some conditions. So this isn't as complicated as it looks, but it's just illustrative. So we also did 55 meta-analyses in the review. And what we saw around the relative risk of vaping, so vaping compared with smoking, we see that there was a significant reduction in a lot of the toxicants, or perhaps there were some similar levels in the bodies of vapers compared with smokers. And then compared, looking at the absolute risk, so vaping compared with not smoking or not vaping, then we either see similar levels or occasionally we see some higher levels. And where we saw those higher levels, it was largely to do with the way the study was conducted rather than people picking up higher levels. So, for example, tobacco-specific nitrosamines, which are cancer-causing chemicals, you would just expect to see in the bodies of smokers and non-vapers. But when you switch from smoking to vaping, you need to allow for a really long time for the effects of smoking to wash out from the body. And if you measure the levels of these chemicals in the bodies of people who've just switched from smoking to vaping, then you'll pick up a lot of the residual smoking chemicals. In terms of the risks to potential harm, there was less research in this area, but in terms of cancer, we weren't seeing that vaping was having the same effect on cells as smoking was. It was having a different effect and a less marked effect. In terms of one's respiratory health, acute exposure, so up to 7 days, you didn't see any differences between, for example, the respiratory health of smokers compared with vapers. But over the longer period of time, so the longer you've stopped smoking and the longer you're vaping, then you're seeing similar levels between vapers and non-vapers, although there was very few studies and those sample sizes are small. In terms of your cardiovascular health, what you see is heart rate and blood pressure is lower in vapers compared with smokers, and then after long-term vaping, it's similar to people who don't smoke and who don't vape. There was only one study amongst people with mental health problems, so people with schizophrenia who switched from smoking to vaping, but it was a very early generation e-cigarette, a cig-alike, and they measured people's respiratory health, and after a short period of time, there didn't seem to be any difference in respiratory health. But that was because a lot of people didn't actually quit smoking with that particular vaping product. So in terms of do e-cigarettes help people stop smoking? So we've looked at this in previous reviews, and we drew data from systematic reviews of randomised controlled trials that the Cochrane group published. We've got data from observational studies led by Leon's team, and then we've got clinical data from NHS Stop Smoking Services. So when we look at what the Cochrane group say, so they do a living systematic review, which means that they're updating their searches every month, and then when they've got enough studies to say something interesting that perhaps changes the findings, then they publish their review regularly. So their last review that was published in November last year, there was 78 studies and included 22,000 participants. And what they found was that quit rates were higher in people randomised to receiving nicotine-containing e-cigarettes compared to nicotine replacement therapy, compared to placebo nicotine, non-nicotine e-cigarettes, but also when compared with behavioural support or no support. And the strongest evidence was for nicotine-containing e-cigarettes compared with NRT. That was the strongest evidence that there were where the effectiveness lie. Leonie presented some data from the Smoking Toolkit study at the beginning of the day, and this is another one of that group's slides. So looking at since 2009, this data is from, up until the third quarter of 2022, what you see since 2013, e-cigarettes have been the most popular quitting aid across the wider general population. So that last data point, 37% of people were using an e-cigarette in their most recent quit attempt, compared with just under 16% who were using nicotine replacement therapy bought over the counter, and compared with 2.4% who've been prescribed nicotine replacement therapy or varenicline by a doctor. And we know that so e-cigarettes are the most popular quitting aid at a population level, but does that mean that they're the most effective? So the UCL group assessed the effectiveness of stop smoking aids across just under 19,000 adults who'd made at least one quit attempt. And what they found was comparable quit rates between e-cigarettes and varenicline. What they didn't find increased your chance of quitting was nicotine replacement therapy bought from a shop without any behavioural support. And because e-cigarettes have a much greater reach than prescribed nicotine replacement therapies or Champix. So if you go back to that previous slide, 37% compared with about 2%, e-cigarettes are helping more people stop smoking. And then if we look at data from stop smoking services in England, what you see is that these blue bars are the percentage of people who are using this type of support. So the most popular type of support in clinical populations and stop smoking services are varenicline and combination NRT. Very few people, so less than 5%, are using a vaping product in a stop smoking service. So that's either on its own or alongside licensed medication consecutively or together. But when you look at the quit rates amongst people who choose these different types of pharmacotherapy, then you see those that use a vaping product with or without licensed medication have got similar quit rates to people who are using the most effective licensed stop smoking medication, which is varenicline. In terms of optimising quit success with e-cigarettes, then there's four things we need to take into account. It's the device people use, the nicotine strength they use, and the type of nicotine, the flavours and frequency of use. So refillable, rechargeable devices, the tank-style devices, are better at delivering nicotine than the pod devices or the disposable devices. Higher concentration nicotine is delivered better than low concentrations of nicotine, and nicotine salts are better than free-base nicotine e-liquid. Non-nicotine flavours, so the fruit flavours, for example, are important to attract adult smokers to vape in the first place and then continue to stay vaping and not smoke. And then daily use is better than infrequent use. There is a bit of data on e-cigarettes for smoking cessation in people with mental health conditions, and this was something we looked at in the 2020 e-cigarette evidence review. But you'll see that there's no randomised control trials. They're largely single-group pre- and post-test interventions. They've got small sample sizes. They're testing them with a population of people who are not interested in quitting, and they're various devices, and then quit rates are variable. The best quit rates we saw is this study by Pasquale Capinetto from Sicily, who gave 40 people with schizophrenia a dual device, but with a higher nicotine concentration that is available in the UK and Europe. It was a 59 milligram per mil device. But what we see with the higher concentration of nicotine and a nicotine salt product, which the other studies didn't include, we have 40% quit rate at 3 months, which is probably the highest quit rates we see in this population. And then just to finish, just a note on how people with poor mental health perceive nicotine containing products. So this was a study we did, a cross-sectional survey with about 3,500 people who smoked in the past year, and categorised into people who had low or no mental distress, people with moderate and serious mental distress. And what we found amongst this sample was that only half of people thought that e-cigarettes were less harmful than tobacco smoking. So the other half thought that e-cigarettes were either just as harmful as smoking or if not more harmful than smoking. And it was people with the most serious mental distress had the most incorrect views. So to summarise, vaping poses only a very small fraction of the risk of smoking, but it's not risk-free, particularly if you've never smoked. But it's a really effective smoking cessation aid. But more studies are needed amongst people with mental health problems. And better communication about the effectiveness and the relative harm of e-cigarettes, as well as nicotine replacement therapy, are needed for people with poor mental health. Thank you very much.